I don't know about you, but I know as a travel nurse, and if I decide to come on staff, just like working 13 weeks contract, I deserve benefits. I need my benefits. Welcome back to my channel. This is Patrice M. Foster. Hello, nurses. How are you today? Let's get it rolling. Let's talk about insurance and how long you have to wait to get insurance. If you've been on YouTube, you know that insurance issue can be costly, can cause a lot of people pain. So we're going to get right into your benefits and insurance, how it goes. Let's start. There's been a lot of talk about health insurance period. But I'm coming out here to talk about insurance benefits specifically for the nurses. I provide value to you. If you get a lot of value from this channel, don't forget to give me a like, subscribe. This 2024, 2025, I need more likes. I need you to give this channel more likes. Support the channel. It's a small channel. I'm not begging for much. All I'm asking you to get these likes up. Subscribe and watch YouTube, and I listen to everybody's story about health insurance, deny, delay, and how costly it is. And I wondered to myself, and it didn't happen to me in terms of what I'm going to talk about, not specifically that I wanted to go to the doctor, but I've worked all over and I had health insurance from the travel agency. And I also had my personal insurance too, health insurance. So when I started this job a while back, and I kept asking, what about the benefits? That's where people usually say benefits, meaning health insurance, dental, whatever, and they may have life insurance, disability, whatever. Depends on where you work. I feel that's my prerogative because I'm used to, I guess I'm spoiled. The other company, they give it to you day one. You don't have to worry. You don't have to worry. So when I applied for this job, I kept asking about benefits. No one responds in human resource. I asked the staff. That's what we nurses do. If we can't get answer from the corporation, we ask the nurses, our peers. So I noticed every nurse I asked, oh, I don't get the insurance here. I'm saying, what's going on? What did I get myself into? I couldn't find a nurse that take the company insurance. And it was kind of odd to me because usually they tell you, oh, the insurance is good. The insurance is expensive. It's too high. But I did not know. For me to find out, I could not find out because I have to wait 90 days before I get health insurance. This was the first for me. And it bothers me because here we are as nurses. We put our heart and soul 100% in our jobs. Yes, every nurse does that. We walk in that door and we say we're going to do this. Sometimes we're upset with ourselves, leaving the family behind on the holiday. And here it is, the job, the employer can't give us insurance. we have to wait 90 days. So, my fellow nurses, what if something happened to us and we can't get insurance because we have to wait 90 days? So you have to pay out of pocket. I thought that was insane to me. I would use another word, but this is YouTube. I thought that was uncaring, that me as an employee and the other nurses or the other staff didn't matter. All it mattered is, and they at the boardroom, they made progress. They sent out newsletter and they did good. Oh, we made a profit with bonus and everything. For them, administration, CEO, they're making the money. Not one to stop, so I keep asking. I asked every new nurse. One new nurse told me, oh, I guess she thought I wanted to know the name of the health insurance. She did say United Healthcare. Need I say more? I don't know. You know. You and I know. Then after a while, the ones that took it in the beginning, they said it was very expensive for them and the family, so they decided not to take it. These are single people. These are people with family. You know, why should we wait? Why should there be a waiting period after 90 days for us to get health insurance? That doesn't make sense to me. And it still doesn't, but I had called a friend of mine in New York and I was talking to her. She's also a nurse. And I asked her, how is it over there? And they said they get their insurance the first day they started. But then she opened my eyes about what's going on, that some employers, specifically maybe the employer I'm working for or was working for, because that wasn't sitting well with me for too long, is that they feel the waiting period is after 90 days. If you can last 90 days, then you deserve health insurance. That's a bunch of crockapot. What's wrong with, and they don't want to pay into it. They don't want to pay into it, so they let you go on. You can't call out sick. You want to go to the doctor, you're going to have to wait after 90 days. It just didn't make sense. So when I heard that, before the election and all the potential presidents were coming out and they were talking about things that they're going to do, they never really focus on the little people, the nurses. Or some people might say I'm biased. I'm only talking about the nurses, but I feel like a lot of people push money to it's just sad. That's all I can say. Whenever I think about it, how we on this floor and our feet hurt, we can't get to go to the bathroom, and we just give it our all. And some of us, no matter what you hear, that nurses make a lot of money, some of us don't have any money. They're just struggling by. And I'm going to do another video on that. How nurses flex, how nurses lie, how nurses make people, the public, believe that we're rich. But it's not so. Behind the scene, we have families to take care of. Most of us can't get a day off. Most of us can't travel. We're struggling. And I'm not saying the other people in other professions is not. I'm just focusing on nurses, that I feel that the employer should at least sacrifice something. I mean, say if the CEO make money, why not consider, that the nurses, what I was just thinking, whenever I work for a company and the CEO is a nurse who used to be on the floor or didn't bypass for some good luck, he or she got to the boardroom, it went downhill for me or for other nurses because they don't think. I used to think that way, but it's the same all over. No matter if the administration is not a nurse, it doesn't matter. Everyone is looking for their bonus at holiday time. And so you're short. You're so severely short. The new company come in, they give you this, and they're going to do this for you, and we're going to be fully staffed, and we're going to give you this, and time and a half after this, and you work 7 to 7, not 7 to 30, because first it was 7 to 30, and then they take away the 30 minutes, and now you get 11.5, not 12 hours. All kind of stuff they do to skimp, to make their bonus get bigger by making it less for the nurses. In your mind, you say you're going to do this, and you take a job. And I used to be the one that hopped from place to place, from job, looking for the higher price, looking for the higher rate, looking for a bigger, better, greener grass. Not to mention I go into a grass that they never water. It's the same everywhere in every state I work. Nurses are an afterthought. Not only, I've talked to some respiratory therapists. It seems like medical people are an afterthought. And it's sad. It's sad. I felt like 2024, we see a lot of downfall of companies going out of business, company lies exposed, people struggling, inflation, everything. We want to keep it, hope alive, but we feel hopeless. That's what 2024 we're leaving behind. And I'm hoping that 2025, continuation of the truth come out, changes. I'm hoping, I said it before, and I'm going to say it again. When I heard that they can't tax, they're not going to be able to tax time and a half or overtime. That's what I heard. That's what the new president said, right? No tax on overtime. But I know in nursing, you ain't going to be doing no overtime, because they're not going to let you do overtime because they don't want to pay that. And I guarantee it's going to happen. If it's not started already, nurses, you got to chime in and let me know. Do you have to wait 90 days? Would you stay at a job that tells you you ain't going to get no benefit for 90 plus days? And you know you need to go to the dentist. You know you need a physical. The only way I would have stayed if I was desperate and I didn't have another job to go to. And believe it or not, the PRN job that I took, if I worked like over 30 hours, they was going to give me benefit, and it will be part-time health benefit. That's even better than, that's a progress for that company. than the one that I was doing full time for. So I wasn't just in the head. This didn't make sense for me. It still don't. I hope as they grow, they put more emphasis treating the staff. I hate when a company comes in new and they promise you everything. They promise you, or it's like they play the political game with you, your mindset. We're going to give you this. Yes, we're going to do this. And the people that you start orientation with, they dwindle out the door one by one. And before you know it, you look up and say, where's so-and-so? We came together. I don't see nobody. Where is the staff? And that's why we will never have staff in nursing settle down. We will always be short. And because of the shortage on their end is a profit. The shortage on our end is pain, delay, denied. Can't progress, can't move nowhere. Most of the time, we decided, and I at one point said, I need to go back to school. I really do. I thought about it even the other day. I said, I need to go back to school. It got to be a better way. Some people say, why don't I come out of nursing? It's not an easy thing to just say, you're going to walk away and retire. I'm not ready for that yet. I still want to keep my skill while I do other things. And I think for me, personally, is to continue to support the nurses that are coming along, the new nurses, and give them the right information so they can know what they're getting into. I'm not going to tell you that you're going to make a lot of money when you come out of school and your first job. I'm not going to tell you that you're going to get everything you want. And please do not go there and in your head and think, oh, I'm going to make a lot of money. I'm going to drive that new Mercedes-Benz. That's the wrong attitude. You will just be struggling. So I wanted to come out here and talk about this waiting period for insurance. It doesn't make sense. Because even in correction, they do that, which I don't understand, because you could get knocked up, you could get pushed down, you could get kicked, and you could get spit on in psych, throw stuff in your face, and you got to go to the doctor and you got to pay for that. Why? Because the company doesn't feel like you deserve to be covered from day one. Because they afraid. I understand they're afraid that we might not stay at their job. But what would be the number one reason why a nurse walk away from that job? Maybe you don't treat us right. Maybe the environment is too toxic. Maybe it's the same thing we were running from. We walked right in the door to it. I hope that these corporate leaders, these corporations, these hospitals is looking into how they treat the nurses. I feel like I give myself, put in 100% when I walk in that door. When I start getting sad, when I hit the door before I enter the hospital, I know it's time for me to go. Something is in there that's pushing me away. And 9 times out of 10, I do listen to myself. Eventually, I try to make it work. I try to push and say, oh, push away those unhappy feeling. I could be laughing and talking and happy at home, but as soon as I got to go to work, I sit in that parking lot and I prayed and I said, God, I don't want to go through this. And I went to the door Before I pushed it, that sad darkness come over me. And it's the truth. There's so much things going on in the nurses. We're tired. Our feet hurt. There's not enough money. And it's not all about the money. And I should talk about the money. I deserve the money. Just like the superstars. They deserve the money. We paying them. Wonderful day or night. Wonderful holiday. Eat. Enjoy the family. Don't work too much. Good night.